I'd like to ask a question from a more legal, or a comment from a more legal perspective, because especially when Noomi was talking about the FarGen project, one of the things we as lawyers tend to address is this, of course, the choice and the opt-in solution and so on. And I think that we actually need to have a new perspective upon this opt-in as well as the opt-out, which I find, as from a law perspective, totally unnerving. But even the opt-in perspective in questions of gene mapping is actually quite problematic, especially in, I think it is, because we are so used to, in a legal point of view, we've been for the last like 200 years focused on the individual. My rights to say yes to treatment, my rights to say no to treatment, and that's okay if it's about me having some treatment affecting only me. But if I opt in a gene mapping project, then I've also opted my children in. And they can't opt out. And especially in a society like the Faroese, in which you've also got all of the church and family genealogy. Do any of the panel have things thoughts about that question? How do we actually handle the fact that my information does not only relate to me?
Very good question. Of course, we you know, and I didn't bring that up, that my genes are not mine, but my family. And we can go even further in the Faroe Islands, that because we are like 5 generations back, we're all related. So now it's not just my families, but the whole population that I'm exposing here. And of course, I think it's really important that we go in the right way. But on the other hand, I don't think we really need genetics or genomics to tell, you know, people know. If there's a disease within the family, they will know. And what we will find with doing the genome project won't be finding like monogenetic diseases. We will just have a look at, like, to explain the complexity of diseases. So, yeah, I don't know if that...
No, if I can just comment just one thing, it's not that they don't know themselves or now they know and everybody else knows, but the rest of the world may potentially know. It's and for generations to come. We don't know what that kind of information that's been gathered now, what you can figure out 10 years from now or 15 years from now. So, yeah.
I think that was very interesting, and we discussed that before, Noomi and I. If you have a very good record of your inhabitants, then you could make probabilistic predictions. For example, in Sweden recently, a man was convicted of rape for 25 years ago because they had a DNA sample from the girl who was raped. They didn't find a match of him, but they found a match on relatives, and then they started to investigate, and he was convicted. So you never know. It can be a lot of issues with that.
I definitely think we shouldn't. I mean, genetics is there to stay, and we have to use it in the right way. So I think that we have to reflect on things and really make things the right way, and being nice. Because if a researcher just wants to get the information, but we really have to be aware of that this information could could harm people in a way without wanting to do it. Yeah.
I have a question to the whole panel, because we've been discussing many of the challenges today, but I don't want this day to finish just, you know, oh, we have so many problems. There are opportunities, and Peder, you had a very good presentation where you told us about the future and what the opportunities are. But these opportunities are basically technological opportunities. So I'd like to have your opinion from all of you regarding how do you see the future in small-scale communities? How do you see that we can address ethical issues, all the issues we've been discussing today, in the future, knowing that, you know, the demographic changes are, as we know, that populations are moving to larger cities. So is the an increased use of technology the way to go? Or do you see other solutions, other opportunities? Or, you know, what's your opinion on this? I really like to know.
Well, I think technology is more way of thinking, is more a concept, more a codex than just the concrete technology that we perform. And no matter what we are thinking here, the people will use technology when it is possible. We've seen that. Mobile phones that today have a solution for a lot of things that we used earlier. So you can't avoid the use of technology. And about the genome discussion, yes, but it will be even more complex. It will be even more possible than just measure the genomes and got some knowledge about that, because the next step is, what are you doing with this person that have different diseases and so on. So it's also a possibility to know everything about the genomes for the next generation. It's not only some scaring or dangerous things. So I don't think it's possible to stop it. It's much better to observe it and be at point each time something new is there. And in local communities, it is a big advantage to use new technology compared to the situation they have today. It's about equality, and equality is equality, for example, to healthcare, and you can reach the healthcare in another way when you use new technology. So observe it and accept that people will invent things, because it's more a codex to think about technology.
I totally agree with you that I think it's important to use the technology we have, and that will be improved in the future. But I think there's one thing that's so important also, to get people more aware of their own responsibility of staying or being healthy. Because I think that issue has not been raised so much. What is my own responsibility over my health? How can I improve my health by exercising, having good nutrition, having my mind healthy? And I think that's important to make people more aware of that, plus using technology also.
Could I supply that, of course, I would like it in a democratic way, not the way we see in China and so on. So we ought to have a democratic system. 2 days ago, a remarkable person and a journalist in the Danish paper Politiken argued that we should have a new Hippocratic oath, not only for people in the healthcare sector, but also people working with genome and IT and so on. So we have a new democratic guarantee that that was the way we could secure everything for the citizens.
This being said, I go in a slightly different direction. I think for me there's a lot of hope for small-scale communities in the future, because we're starting to talk about these kinds of issues. So I think more and more over time I'm becoming more passionate about encouraging small communities not to have to apologize for we don't know what, we still have things to learn, but also saying we also have something to teach, right? That we do have things that we've sorted out. We deal with complex challenges in different kinds of ways in small communities, and I think that flexibility, that resilience, those are things that we can offer to the broader community, both in terms of ethics, but also more generally. And I think that's something for me that I take away from a conference like this, is that it's okay. It's making sense to us. So how do we use that to help encourage change at the other levels, right? And bring those messages forward.
The Faroe Islands being very small, I think even though it's small, it's very important to people to be close to home, even to get treatment at home if they want that. Dialysis, how do you say dialysis in English? Dialysis, yes. At home has been a huge problem in the Faroe Islands. So the patient groups see great importance in being as close to home as possible, also delivering their babies.
Yeah. What we learned from the FarGen is that people really want to be a part. So I think it's really important to engage people and you know, learn like education in how to use this knowledge for the good, because that will be actually really be a challenge.
I think technology is excellent, the genome is excellent. It's also excellent to be a small community, to be indigenous, to have the opportunity of using all the possibility, but still to have this opportunity to be indigenous or remote area, you also have to question that. We have this discussion about Trump buying Greenland. It's a very ethical question which have a lot of ethic into, are we still allowed to be remote community? So we have to be aware of what is important for us in the future, and for everybody of us to take this responsibility to say, this is a good life for us, we will go for that.
Yes, I think also technology is here to stay, and we need to learn how to use it in the best way. And the second thing, I think we need to do research about how it is in small-scale communities. So we have to have more knowledge about that.
And I'm very optimistic about small-scale communities because it is the future. We have already experienced for more than 20 years what is becoming more and more apparent in other parts of the world. So we have been forced to develop, for example, video conference. We have been forced to develop robotic techniques. We have recently developed drones for long transport, not these short ones in the cities, but for 100 kilometers. And I've been more and more passionate about this development for sustainable development. We can lead the way for other communities and societies. And what we have experienced in Storuman is that more and more people around the world get in contact. They want to collaborate with us. So I'm optimistic that the small-scale communities could connect to each other and could really show the rest of the world who should own Greenland, for example.
Yes, being the last, I can only say I agree to all this. And this is so fascinating, and all this technology. And we should use it, of course, in this distributed areas all over. But there is one thing that I would like to say as a nurse. And also because we have your presentation here, the last presentation, what do the patient want? What do they say? And I would add, what do my student nurses say? There is not enough time for a human touch, for being with the patient, because it's the present of the body, which is important. You can't touch the patient with the technology, but you can do a lot with technology. Don't misunderstand what I'm saying. But don't replace the human touch with technology, please, because that is not what we should do. And this robot there, I thought it was fascinating. It's just, whoops, we will all be sent out to a robot soon. What's the name again?
Drone.
Yes. Yes, we were joking last night about all this. But yes, that's another story. That's another presentation. And well, but I feel so strongly about this, and maybe because of all these years I've spent at the bedside of patients who are really ill and dying. But so that's what I want to say. But great, and I would just say that I'm so happy that I was invited to come to this conference. It's great. It's been a great day.
We have one more question for you, Sigfríður.
Okay, I'm not going to ask a question of everyone. But I was just a little curious to hear a little bit from Christy, because she opened the day for us by really mapping, at least conceptually and in terms of understanding, or orienting our thinking, I should say, around healthcare and research in rural areas and in small-scale communities. And then we had all this information that has happened since and all this discussion. So I'm curious to know what you would think now after having heard all this. I know it's late in the day and maybe you're just tired, you don't feel like talking about it. If there's anything there, what sort of stands out as things that either reflect and confirm your understanding of this? Because I mean, you've researched this, you've written a book and articles and everything, so it's like you have a firm kind of understanding, but what reflects that and reaffirms that, and what maybe contradicts it? What is something you did not expect to hear and you heard, and so on and so forth? So just some highlights that you would like to share with us.
Yeah, there's a lot of different ways I could go with that one. And I was typing away. If you noticed, I was typing a variety of things because I took something from every talk. And it got me to think more, I think both, if I think about it from an ethical theory kind of perspective, I think one of the things that I feel really positive about is that what I was saying made sense. Because partly I recognize a lot of the rural health ethics literature is very US based. There's some Australian, some UK, some Canadian rural health ethics work, but not a whole lot. And so Fiona and I, when working on the book, we're very conscious of the fact that there are voices that are missing. And we wanted to add a more Canadian, Australian, New Zealand kind of perspective to that. So being here today and hearing that what I'm talking about makes sense, that there are common threads. If you're a small scale community, something makes sense about what we're talking about, and we find commonalities even while we may have different experiences. It may be different sizes of geography about how far we're traveling, or whether it's a cultural difference that we're navigating, as that's the small community that we're looking at. So it makes me more excited about what do I want to write about next, in that kind of sense. And there was a question around where is the rural health ethics theory, right? Sort of where is that? And I think that's the part that I'm going, okay, well, now that I've started to ask all these questions, how do we, and we're moving on the direction about how to start answering them, but how do we start to write about how to answer them? And especially in a way that will help with education and training for our future healthcare providers, because I think that's one area that's critical, that is missing across the many curricula. Because if we make it, not hiding the challenges, but if we make it interesting and intriguing and having real benefits, It may attract more people to work in the communities, which also will help facilitate research, but also care and the use of technology, right? People will come with different ideas that I think is really useful. But the last presentation, and I was just sharing with you, it also reminded me not to forget about the voices of patients, right? And sort of where you were coming with your final comment is what a privilege to hear through your organizations. Wait a minute, this is what it looks like for us. I love the family too much, family too little. Oh, fascinating. And it plays out in so many different kinds of ways. But also that part of small communities can be a place where voices can be heard and are often heard and people join together, but we don't always raise our voices collectively in the broader system, right? We still feel very marginalized and very separate, and I think that's the other piece that kind of resonates through a variety of the presentations about the ways in which gender and rurality kind of overlap, because that's part of what's going on too, right? And so those intersections with other ways in which we see difference, bias play out around our indigenous communities, around who, I mean, those questions of who owns what, who should own what, whatever context they're in, I think are absolutely essential. And that's where my hope was coming from before in answering your question around, I like seeing that our voices are starting to connect and to make connections, make those collaborations so that our voice becomes stronger, because small communities may change, they may look different over time, but I don't think they're ever going to go away. Some things can only happen, I was saying to somebody earlier, some things can only happen in small communities. If you're farming, you need to be in a rural setting. If you're fishing, you need to be by the ocean, right? You know, some of those kinds of things, and you can't have everybody in a big city. So we need to claim that back and be proud of that and really encourage it. And I think ethics is a great lens to bring together sort of the conceptual pieces, but also the really applied, practical, what does it mean for us? What does it mean for this person, this family, this community? But what does it mean for all of us that are small-scale communities? So that's where I'd leave it. Yeah, sure.
May I suggest something, because perhaps it means more than all here are concerned about the small-scale community and the research you are performing than you consider. There are a lot of small-scale communities inside the urban cities. The product that you come up with could be used in small-scale communities. It could be partly of very big cities, but all the e-health city projects I've seen around the world, Toronto, for example, they have small-scale communities inside. So what you experience, you could transport back to these areas. And if we could convince people that, and researchers also in the big cities, that they could pick up something here and try it into the big cities, it has a double value what you are performing.
Absolutely. Yeah. No, thanks. Yeah, and that's where I recognize my own bias is a geographical reality, right? I know that, and yet it still creeps in. So that's a great reminder of, especially the health geographers, I think I was saying at one point, they're moving into some of these areas and some of these territories, and I think we'll start to see more communication and conversation around those types of small-scale communities too. Yeah, thanks.
And we have experienced that already, that researchers want to use our technology in suburbs of Stockholm, for example. But what we have discussed a lot is that we see also a danger if you come with an urban agenda. So we need the voice, we need the rural, the sparsely populated perspective, because it can be dangerous if you just go back to some kind of colonialism to research. So therefore we need to strengthen our voice to give our perspective.
I think we have one more question here. Yes? Hi. I'm a student here, studying to be a nurse. And it's been very interesting hearing all of you, but if you talk about the future and in small-scale societies, the elderly people, like in nursing homes, and also those who live at home, they play a really big part here in the Faroe Islands. And being a student and being a how do you call, being in as a nurse student in the nursing homes, we see that not the elderly people do not have a voice. And you talk about the families being like a big part, but it's like we're missing that they have to be a bigger part to be their voice in the small-scale societies. And also in the Faroe Islands, they talk about that the elderly people will be, there will be more old people, not old people, elderly people than younger people here in the Faroe Islands. And they are talking about, how do you say it? Build, yeah. To build nursing homes, bigger nursing homes, because the condition dementia is increasing. Yes, and I just want to hear just the opinion of some of you. What do you think about the older people? Because you are all researchers, and I miss hearing something about what you want to do in the future with the elderly, because they don't have a voice, all of them.
Can I say something? Thank you very much. This is really important. Through research and just through clinic and through so many things, I have been really sad to witness that old people in nursing homes, they don't have a voice. There is someone else deciding what is best for them. They put in this theory and that theory because that's best for the old people in these nursing homes. But if you really look at the research, they have not been asked. It's somebody else, it's someone, healthcare professionals, whoever, but there is just a gap there. I want to see evidence where the old people are saying what is best for them and what they want. So thank you for reminding us about this. Thank you. Hope you will do something about it. You are the young generation. We have a lot of, we believe in you, so please, before we are put in there, you know. Thank you.
Okay, I think we're going to close the day now. It's been a very rich day. I wanted to wrap up what we've been discussing today, but Christy just did that for me. But I think the take-home message for me was really education. We should tell healthcare professionals about what is it, and researchers, to be, what is it to be a small-scale community? What is it? What does it mean to work in a small-scale communities, and what are the challenges? And I really like the point that was made about small communities joining forces, working together. It's really, really a good point, I think. So I think maybe don't count on the big cities. You just have to come up with solutions yourself. And use the tools that are there, use the technology. So maybe that's the biggest or the most important thing that I've learned today. I'd really like to give you a very warm thank you to all of you. I know some of you have traveled long distances to come here. We really appreciate and we really enjoyed having you here and listening to your talks. So thank you so much for that. So I would like all of us to give an additional thank you to the speakers. I'd also like to thank the Nordic Committee on Bioethics and especially Anna, Marianne and Susanna. You put a lot of work into preparing this conference. So thank you, thank you, thank you.